As our population ages, it's just a sign that people are staying more active for more years of their life, which is great. It's fantastic. It's a good problem to have, but it just brings in a challenge to my end of talking to patients about staying healthy longer, as well as on the surgical side. Age is no longer really as big a concern about undergoing surgery as it used to be. It's more looking at the patient as a whole and looking at their medical comorbidities. So talking to an 80-year-old about a spine surgery isn't as daunting as it used to be. So that's one thing that a lot of patients are concerned about is their age, and it's really, you're as young as you feel. So I've seen a lot of older patients who are very active, very healthy, and feel great, except for they have back pain. And those patients would do really well with surgery. The average patient that I have seen over the years has changed in terms of expectations and what they're doing. So the body ages at a certain predetermined sort of schedule, and everyone's genetics determines that. But most of the time you start to get these wear and tear and arthritic problems. You start to see these wear and tear and arthritic problems in patients around 50s, 60s, 70s. And maybe a few years ago, a 70-year-old patient would not be doing very much, just maybe going for a walk and hanging out with grandkids. Now I see 70-year-old patients who are wanting to play pickleball, tennis, all kinds of activities, which is really exciting for me to see patients staying healthy so long. So just sort of what they're doing with their lives has changed. And so that sets up a higher bar for me as a surgeon, and just sort of reminds me that people stay active as long as they can. So I really enjoy being able to get them back to their activities. So I do see a fair amount of patients that have been to their primary care doctor or have seen a physiatrist or a pain management specialist. And then through the NYU MyChart portal, a lot of patients just make appointments with me directly, which is great because I'm happy to talk to anyone who will listen about back health. And so those patients that are a little more app or technology savvy or used to just sort of making appointments that way are younger, usually healthier. Usually it's their first time seeing someone about their back pain. I see a lot of patients who are in that just after college time frame, and they're making the transition from college life to worker bee life, the daily commute, carrying a bag, sitting at a desk. So a lot of that can tweak your back. And so I talk to them about good work ergonomics and things like that. And I really respect the fact that they are taking the time to invest in their back health now to try and prevent problems in the future.